Obstructive sleep apnea, OSA, affecting nearly 30 million Americans, disrupts one's rest by causing repeated pauses in breathing. OSA can take a major toll on one's quality of life. However, with oral appliance therapy, an alternative to CPAP, you can positively confront these challenges by receiving comparable medical value to CPAP and maximizing quality of life value together.
Sleep apnea is a condition whereby some people, when they sleep, are unable to breathe at the same time. The proper term for sleep apnea is obstructive sleep apnea. There's also a central sleep apnea, which is much less common. In obstructive sleep apnea, part of the airway here obstructs while you're sleeping. The roof of the mouth is called a palate. At the front it's bony, so it's called a hard palate. At the back it's fleshy, it's called a soft palate. The soft palate can vibrate back and forth like this as you breathe in and out while you're sleeping. That's actually what causes the snoring noise. But in some people, the soft palate, which is here, and below it the tongue, can fall back and close off the airway here. This is called an apnea or not breathing episode. When you stop breathing, the oxygen level in your blood starts to fall. Eventually your brain says, "I don't like this," and it wakes you up. Now most awakenings are very brief, they only last 3 or 4 seconds, therefore you won't remember waking up at night time if this happens to you. As soon as you're awake, you're normal, start breathing, fall asleep, stop breathing, wake up again. And this pattern can go on throughout the night. If you have this recurring awakening during the night, you're not getting adequate proper sleep at night, therefore your sleep is not refreshing.
My husband said, "You have sleep apnea." He has sleep apnea, so he knows, and he just sort of looked over at me one day and was like, "You really ought to have a sleep study because you snore like crazy and you stop breathing and you should go." So I did, and I had the sleep study, and they said, "Yes, you definitely have sleep apnea."
There are several things you can do to treat sleep apnea. The most widely used treatment is a thing called nasal CPAP. Nasal means nose, CPAP stands for CPAP, which means continuous positive airway pressure. Basically what that means is when you go to bed, you put a mask over your face, which is attached to a small machine. It's just an air pump. It blows air in under pressure and forces the soft palate here and below it the tongue forwards, opens up the airway here and controls the problem. The standard of treatment, first line treatment for obstructive sleep apnea is nasal CPAP.
So I immediately got the standard treatment, which is the CPAP. And then I got pregnant, and I had my daughter, and when I had my daughter, I couldn't handle the CPAP at all because I wasn't sure that I was hearing her at night. And so I just stopped using my CPAP completely, and I was completely untreated, and I was miserable.
Sleep is an integral part of life. How to treat sleep apnea can not only affect the patient's sleep, but also awake moments. Furthermore, it even affects the life of and the relationship with their loved ones.
The American Academy of Sleep Medicine also recognizes dental retaining devices or dental devices as a suitable alternative, especially in patients who have mild to moderate obstructive sleep apnea.
I went in and I saw Dr. Tucker, and he was great, and he said, "I think this could really make a difference in your life. Let's get started." And that really did change everything.
We went through a couple different appliances before we ended up with the Whole U appliance. She absolutely loves it. She's had a very positive outcome with her obstructive sleep apnea now being controlled with the Whole U appliance. She has way more energy, she can sleep through the night, and finally with the Whole U appliance, she's living a vibrant, healthy life and enjoying her child.
So when we're developing the devices, we consult with the leading experts in the industry to make sure that the appliances are not only going to work for them, but also for their diverse patient needs. So in doing that, we have a wide variety of devices to cover each patient need. We have the Respire Blue, which is our signature device. This device is not connected, meaning the patient can put one piece in and then put the next piece in to get comfortable with it. They're not locked into any given position. It has an adjustable screw to bring the jaw forward as the patient goes through treatment, and it can be made with a soft fitting surface as well as a hard acrylic fitting surface too. We also have the Respire Pink, which is suitable for patients who brux and grind during the night. So clenching, grinding is something that's really correlated with sleep apnea. Now this device also has a compliance monitor, so we can check that the patient is wearing the device during the night. And this version is the EF version, which stands for the Endurance Framework. So it's a very, very thin material, but still very, very strong. So the idea is that we're trying to get as much tongue space for the patient as possible. We also have the Pink Micro device, which is around 20% shorter of a herb stem on the side than the standard pink device. So this is really useful for patients who have a narrow jaw or who've had teeth extracted and need that extra space inside of their mouth. By bringing innovative oral devices to the market, they not only provide medical value, but also bring quality to people's lives.
When I got to the whole U, that was the one. It's just so simple, and it worked. It worked for me. I would sleep all the way through the night, and I didn't have anything that got ripped off, and I wasn't having the Darth Vader sounds that you have with the CPAP, and then it was great. With sleep apnea, you're done. There is no nice Rebecca for anybody anymore. It's just, you're done. But I'm not done anymore. Now, it's 7, I got things to do.
We believe in the power of positive messaging to not only motivate but also educate patients that oral appliances are a viable option for treating sleep apnea. We're doing this by going around the country and meeting users of these appliances. And with the City of Sleepers campaign, we're able to interview and meet and see how the devices have changed those people's lives and give them the ability to live their life to the fullest. We also believe that these stories will inspire and motivate more people to start the human-centric treatment from Whole U.
You start realizing things that used to bother you to do don't bother you anymore. When the schedule for my daughter's soccer team came out and it was games at 7:15, that is no longer frightening. If I get sleepy, I put in the device and I'm going to sleep the whole night through. And I'm going to wake up, I'm going to feel better in the morning than I did when I went to bed. And Whole U did that and changed that for me. Whole U has made sleep something I can enjoy again.
To learn more about Whole U, visit wholeu.com.